So hi to all. So today we are going to see Losartan. So Losartan is an angiotensin 2 receptor blocker used to treat hypertension. So we know that angiotensin 2 is going to bind to two type of receptors, 81 and 82. So our drug Losartan is an angiotensin 2 receptor blocker used to treat hypertension. Angiotensin converting enzyme inhibitor are used for a similar indication but are associated with a cough. When patients with a angiotensin converting inhibitor associated coughs are switched to ARB like Losartan, they have an incident of cough similar to placebo or hydrochlorothiazide. So Losartan is available as a Losartan potassium oral tablets as well as combination tablets of Losartan potassium and hydrochlorothiazide. Patient taking a Losartan should have their renal function and potassium levels monitored. Okay, so it has been approved by FDA on 14th April 1995. So if you see the structure, what it will have, it has a basic nucleus imidazole followed by the biphenyl, so with the methyl bridge. So then it will have the tetraazole nucleus. So this is the basic moiety how to remember the structure. So let's draw the structure now. So what it will have, so it have almost one imidazole nucleus. So it has imidazole nucleus. So this imidazole nucleus, so is going to show the chlorine halogen, then followed by methanol. So we have a butyl chain, we have butyl chain 1 2 3 4, sorry, we have 1 2 3 and 4. So we have the butyl chain, then followed by, so we are drawing the structure of Losartan. So here we have the imidazole nucleus with the chlorine and methanol followed by the butyl chain. So to this one of the nitrogen, so we have the methyl bridge that attaches to the biphenyl system. So we are going to see the attachment of biphenyl. So where the tetraazole molecule is going to bind, so here your tetraazole molecule is going to bind so this about the entire molecular structure of tetraazole. So if you see the IUPAC name, so if you see the IUPAC name, so here we have the imidazole basic nucleus. I am going to take the basic nucleus. So now I am going to give the IUPAC name as starting with the side chain that attaches to the imidazole as a 2-butyl. So 2-butyl, then followed by 1 2 3 and 4. So 2-butyl followed by 4-chloro 2-butyl 4-chloro 1. So open the brackets for the side chain of biphenyl system as 2. So in which you are going to get a tetrazole tetrazole 5-yl tetrazole 5-yl. So 1 comma 1 biphenyl 1 comma 1 biphenyl. So 4-aryl 1 comma 1 biphenyl 4-aryl 1H imidazole 1H imidazole 5 methanol 5 methanol. So this about the entire structure. Now I have to remember we have one basic moiety, that is imidazole, showing butyl side chain followed by biphenyl system, then followed by the tetrazole nucleus. If you want to segregate this molecule so into the basic nucleus, before the class, before we have the discussion how to remember the structure based on the basic nucleus, functional group and side chain. Imagine we have the functional group as so imidazole, and we have the side chain as a biphenyls, and we have another functional group as imagine the functional, otherwise the molecule, as tetrazole. Okay, now I have to synthesize. So if you want to synthesize, let's know here. So we have the biphenyl system. Take the biphenyl. So biphenyl, that is nothing but a cyanide, which is a 2 cyano 4 bromo 2 cyano 2 cyano 4 bromo 2 cyano 4 bromo 2 cyano 4 bromo methyl 4 bromo methyl biphenyl. This is a methyl biphenyl. We have the methyl group, so we are going to show here that attaches to this biphenyl. So 2 cyano, so that position of the 4 bromo methyl 4 bromo methyl biphenyl biphenyl. So it's going to make a reaction with the basic imidazole nucleus that having the butyl side chain and methanol and chlorine. So here we have the butyl side chain, then here we are going to see the chlorine. It's going to make the reaction in presence of sodium methoxide in methanol, okay, sodium methoxide in DMF, dimethyl formamide. So what is the need of using the dimethyl formamide? We have to remove the excess methanol. That's why the intention to use the DMF here. So we are going to get an intermediate now. So we are going to see an intermediate now. I don't have the space, that's why I erased. So we are going to see an intermediate. So this intermediate, so is going to show the methanol followed by the butyl side chain. Here we have the biphenyl cyano group, biphenyl cyano group attachment. This intermediate upon reaction in presence of NaN3 and NH4Cl, ammonium chloride and TMF. So that's going to give our Losartan as a final product. See here how we are going to simplify the synthesis. So this is the overall synthesis what we have. So now, so we are going to see the SAR. So before that, let's see mechanism of action. So how it's going to inhibit. So we'll have a structures of angiotensin 1 and angiotensin 2. So we are going to see two structures here, angiotensin 1 and angiotensin 2. So if you see the mechanism, what it's going to do, it's going for inhibition of angiotensin 2 binding to AT1 inhibits. That means we have the receptors. Initially, I mentioned that we have two type of receptors where your angiotensin 2 is going to bind. One is AT1 and AT2 receptor, where your AT1 is going to carry on the vasoconstriction and aldosterone secreting actions. Okay, our losartan is going to bind to angiotensin 2, thereby inhibiting the binding of AT1 receptors. So parallelly, we are going to achieve the mechanism of inhibiting vasoconstriction and aldosterone secreting effect. So final output of decreasing the vascular resistance and blood pressure. So if you see the feasibility, losartan is 1,000 times more selective for AT1 than AT2. Okay, so inhibition of aldosterone secretion so finally leads to increasing sodium and water excretion, decreasing the potassium excretion. So losartan is effective for reducing blood pressure and may be used to treat essential hypertension. Okay, left ventricular hypertrophy and diabetic neuropathy. If you see the structures of angiotensin 1 and angiotensin 2, so what's the need to design this molecule? See the overall structure. So we have here pyrrolidine nucleus. So it's resemble as that of the basic nucleus for captopril and enalapril. Then here we have the imidazole, the basic nucleosides and non-competitive inhibitor. Then so we have the imidazole. So that's the main intention here to develop. Similarly for angiotensin 2 also we have imidazole, then pyrrolidine nucleus. Okay, so based on this criteria, so we have been framed a bio-friendly molecule that has to go and accept the competition. Okay, so there it has to go and reach there. So our losartan is going to get 1,000 times more selective for AT1 receptor than AT2 receptor binding effect. Okay, so if you see, so if you see the mechanism, what is going to do, so this is the overall mechanism. Okay, then metabolism. What about the metabolism for losartan? So losartan is an active, orally active agent that undergoes phosphorus metabolism. Okay, so imagine it is a prodrug. So by active transformation into an carboxylic acid derivative, so it's going to reach to the angiotensin 2 receptor, thereby achieving the antagonism. Okay, so it is going to transform into an active metabolite. So that's metabolite by carboxylic acid substitution there. So by the presence of an enzyme cytochrome P450. Okay, then let us come. So important topic here we have diuretics. So what are diuretics? So diuretics stands for, diuretics also called as water pills, common treatment for high blood pressure. That's a need that's been included in our syllabus. Okay, so how it's going to use, how it's going to achieve this overall mechanism. So it helps to rid our body of salts and water. Salt in the sense the sodium, most of them help your kidney releases more sodium into your urine. Okay, the sodium has to be released into your urine. The sodium takes with it water from your blood, decreasing the amount of fluid flowing through your veins and arteries. This reduces the blood pressure. Okay, it's very nice. So where it's going to carry on this overall mechanism, let's draw the nephron. Here we have the nephron. So the Bowman capsule where you are going to see the blood, so where you are going to see the capillaries. Okay, so our blood is going to be carried in and out from here. So where it's going to eliminate the salts. So from here we are going to initiate the proximal convoluted tubule. So this proximal convoluted tubule, if you see the exchange of ions by the co-transporter that present in the epithelium layer. So imagine we have the co-transporter to transport these ions if we are going in proximal. So this is the proximal convoluted tubule. Let's draw the entire nephron. So from the proximal we are going to see loop of Henle. So we are going to see the loop of Henle. So this loop of Henle going to give a distal a convoluted a tubule, distal convoluted tubule. So from this distal convoluted tubule, finally we are going to see the collecting tubule. So this is the collecting tubule, this is the distal convoluted tubule. So see how the ions going to be exchanged here. In proximal, the sodium is going to be exit and chlorine followed by the water. So this is the mechanism at the proximal. Parallelly we are going to see the entry of the protons, potassium followed by ammonia and urea here. So then in a loop of Henle, so loop of Henle also we are going to see the exit of the sodium then followed by chlorine. Okay, similarly here you are going to see the entry of urea, sorry, here the entry of urea. Then in a distal convoluted tubule, so we are going to see NaCl exit and entry of the potassium, the H plus ions, ammonia and H3. So finally our concentrated urine is going to reach to the collecting duct. So where it's going to be reached to the overall urinary bladder. So this is going to happen in a two type of mechanism. One is passive diffusion, another one is nothing but active transport, otherwise by secretion. Okay, so this is going to be controlled, otherwise increasing ionic gradient interstitial fluid, it's going to be done there. Okay, so we have to frame the drugs such a way it has to maintain this overall mechanism. So we have to classify the drugs based on this mechanism that has to control the transport of these drugs between the co-transporter. So how it has been classified? So it has been classified as a loop diuretics, thiazides and carbonic anhydrase inhibitors. Loop diuretics inhibit the sodium potassium chloride co-transport in the thick ascending limb. Very nice. Then thiazides are the most used diuretics, inhibit the sodium chloride that means transporter in the distal tubule. Carbonic anhydrase, okay, so inhibit the transport of bicarbonates out of the proximal convoluted tubule into the interstitium, which leads to less sodium reabsorption at the site and therefore greater sodium bicarbonate and water loss in the urine. Okay, this is the overall mechanism. Then what may be the classification and what are the drugs we are going to see under this classification? So if you see the drugs, if you see the drugs, so for thiazides, what we are going to use, those are nothing but chlorothiazides, chlorothiazides, then followed by hydrochlorothiazides, 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 indapamide, then metazolone. So these are the thiazides. Next, loop diuretics. So we have to go for the loop diuretics. Here we have bumetanide, ethacranic acid, furosemide, torsemide, torsemide. Apart from that, we have furosemide, torsemide. Apart from that, we have potassium sparing diuretics, potassium sparing diuretics. So these are amiloride, eplerenone, spironolactone, triamterene. So these are the examples. Next, apart from that, what we have? So we have carbonic anhydrase inhibitor, carbonic anhydrase inhibitor. What those are? Acetazolamide. Then apart from that, dorzolamide, dorzolamide. So these are the examples. So in our syllabus, what we have? We have an important molecule, carbonic anhydrase inhibitor, that is nothing but acetazolamide. Okay, several forms of carbonic anhydrase. We have to inhibit the enzyme carbonic anhydrase. We have, if you see the structure, so anhydrase normally occurs in nature. So in the best studies, alpha carbonic anhydrase form present in animals. The zinc ion in it has a coordinate by the imidazole rings of three histidine residues. So those are nothing but histidine 94, 96, and we have 119. So these are the residues. The primary function of the enzyme in animals is to interconvert the carbon dioxide and bicarbonate to maintain the acid base balance in blood and other tissues and help to transport carbon dioxide out of the tissues. So if you see the acetazolamide molecule, so how to remember the structure? So as per the previous data, how we are going to see a molecule. So let's go the functionality, then side chain and basic nucleus. What we have? The basic nucleus is nothing but, so here the basic nucleus is nothing but, we have, sorry, the basic nucleus, let's draw the structure. I can't get this pen. So what the basic nucleus we have? So we have thiadiazole. We have the thiadiazole. So two nitrogen atoms, diazoles. Okay, this about our basic molecule. Here we have sulfamide side chain. Sulfamide side chain here, amine. Okay, then followed by acetaamino, followed by acetaamino. This is about the entire structure, the basic molecule here, then side chain, then followed by what we'll have. So we have the functional group as acetamino. So 2 acetyl amino, 1 comma 3 comma 4 thiadiazole, 5 sulfonamide. Okay, so this about the entire 1, 2, 3, 4 and 5. So this about the naming of the molecule. So we seen the molecular structure. So let's see the SAR of acetazolamide. So we know the importance of overall molecule. We have the side chain, presence of sulfonamide moiety necessary for diuretic action. Presence of sulfonamide moiety is essential for diuretic action. So this is the sulfonamide moiety. So that's why it comes under sulfonamide drugs. Presence of sulfonamide moiety necessary for diuretic activity. Nitrogen group of sulfonamide remains unsubstituted for its activity. We should not go for any substitution on these sulfonamides. Then followed by, if want to make any substitution, we have to go for giving methyl group there in order to retain the activity. So apart from that, presence of acetyl, that means acetamide, will plays an important role. So in addition to this carbonic anhydrase inhibitor, our basic molecule will also shows anticonvulsant, antimicrobial activity. Okay, so it will have the series of explanation. See the mechanism of action. Acetazolamide is a sulfonamide derivative with diuretic, anti-glaucoma, anti-convulsant. So how we are going to achieve the anti-glaucoma in order to reduce the intraocular pressure? So we're going to continue. First we'll see it's a non-competitive inhibitor of carbonic anhydrase, an enzyme found in cells proximal tube of the kidney, eyes and glial cells. Inhibit of this enzyme, kidney prevents the excretion of the hydrogen, leading to increased bicarbonates and cation excretion and increases the urine volume, finally results in alkaline diuresis. Acetazolamide reduces the concentration of bicarbonate, result in a decreased synthesis of aqueous humor in eyes. Okay, so due to this, it's going to decrease the amount of fluid that can build up in the eyes. So that's going for lowering the intraocular pressure. Metabolism, if you see, it's not metabolized, that means active form of the drug going to be eliminated as such. Uses, it's a water pill, decreases the amount of fluid, so that can be built up in the eyes, decreasing buildup of body fluids, that means edema caused by congestive heart failure or certain medications. This is the main intention to include this drug in antihypertensive. Drug interaction, if you see the possible interaction, acetazolamide may interact, it's going to be interact with the series of drugs as ciproprid, so methenamine, anticonvulsants. Then if you see other drugs, diuretics, cyclosporine, digoxin, drugs for diabetics, and drugs that cause loss of potassium, lithium, memantine, so followed by procainamide, quinidine, then finally your non-steroidal anti-inflammatory drug aspirin. So these are the adverse drug interactions. Then if you see the important role of these drugs, so how it's going to regulate, so it's going to eliminate the excess body fluids, thereby it's going to control the congestive heart failure. So this is one of the important aspect. So toxicity, if you see the toxicity, include hypotension, tachycardia, or bradycardia due to vagal stimulation. A supportive treatment should be instituted for symptomatic hypotension. So hemodialysis will not remove losartan or its active metabolite. So if you are going to give this in combination with losartan, so this about the losartan. Okay, so you have to be very careful toxicity of losartan. Okay, we have to minimize in combination with losartan, because if you see the losartan toxicity, so tachycardia and bradycardia is going to cause if acetazolamide has been given, so by hemodialysis will not remove the losartan or its active metabolite. Okay, so to their high rate of protein binding, we have high rate of protein binding, so that's why you have to be very careful while giving in combination of acetazolamide with losartan. Okay, then if you see the side effects of acetazolamide, so what it will cause, so acetazolamide normally, so light headedness or increased urination may occur, especially during the first few days or your body adjusts to the medication. So blue red vision, dry mouth, drowsiness, loss of appetite, nausea, so vomitings. So these are the causative things. So we may see for acetazolamide. So then apart from that, so what we are going to see for acetazolamide, so they can be sold under the brand names as a Diamox. Then among other is a medication used to treat for the glaucoma, epilepsy, and altitude sickness and periodic paralysis, so idiopathic intracranial hypertension, that means a raised brain pressure. So this may be the conditions we can use acetazolamide. Then so the half life of the drug 3 to 9 hours, so it will take almost 3 to 9 hours. Then after that, so we seen the toxicity for the Losartan. So we are not going to get any information on this acetazolamide toxicity. Okay, so thanks for the class. Tomorrow we'll continue next topic, hydrochlorothiazide. So let's will start.